Preparing for childbirth is a unique time where you face a lot of unknown. Giving birth during a pandemic brings this unknown to a whole new level. Knowing what to expect and to prepare for can help. In this segment, I'd like to share what it's like to give birth at UC San Diego Hospital during the COVID-19 pandemic. There are a number of steps we're taking to help protect patients from getting COVID-19 when they come to the hospital. First, all patients are screened for signs of infection for COVID-19 before they enter the hospital or the clinic. Visitors are limited to only one support person per patient. We have exclusive double masking, which means that all patients and all support persons are masked when they come into the hospital, and all providers of any kind of patient care are masked as well. We have universal testing of all healthcare providers and staff to ensure that no one is carrying COVID-19 without knowing it, so without having symptoms. And finally, we have universal testing of all patients who are being admitted to the hospital to ensure that we know whether or not they have COVID upon admission. This allows us to make sure there's proper isolation and appropriate cleaning of any rooms and supplies between patients. There have been no instances of a labor and delivery patient getting COVID-19 from coming to UC San Diego, and we're working very hard to keep it that way. UC San Diego has applied the recommendations from the CDC and ACOG to modify our protocols on labor and delivery to ensure patient safety during COVID-19. For example, patients are limited to one support person for the entirety of their delivery and postpartum recovery. This needs to be the same person to minimize the number of people coming on and off the unit. We can't allow for the use of nitrous oxide gas for pain control. All doula work is currently being done virtually, although we are hoping to bring back in-person doula work soon to the hospital. And finally, walking during labor must be confined to a patient's room. Patients are not able to walk in the hallways. So here at UC San Diego Health, we've reduced the number of in-person obstetrics visits by supplementing with telehealth visits for patients whenever possible. That means you would use your phone to connect with your healthcare provider. Your safety is our top priority, and we weigh your individual risk based on your gestational age, your comorbidities, when we make that recommendation for how many telehealth visits you need versus how many in-person visits. It's still important to have sufficient in-person evaluation during your prenatal care to ensure that you are well cared for during your pregnancy. If you're a UC San Diego patient and you think you have symptoms of COVID-19 during pregnancy, please call the OB COVID-19 hotline to obtain testing and guidance on next steps. If you're not a UC San Diego patient, please call your primary obstetrics provider for further instructions. If you test positive for COVID-19 during pregnancy, it's important to let your primary obstetrics provider know. Fortunately, most pregnant women will be able to stay at home to recover and should receive guidance on how to protect their family while they're quarantined at home. Here at UC San Diego, our obstetrics and infectious disease teams work together to provide frequent check-ins by phone for our pregnant patients who have COVID-19. That way we can identify any concerning symptoms early and encourage any patient that needs to come in for further in-person evaluation or possible hospitalization. If you're found to have COVID-19 at the time of delivery, your care team will be in special protective gear while taking care of you. You, your family, and the pediatrics team will work together to make individualized decisions regarding options to keep your baby safe after delivery. Wearing a mask around your infant, frequent hand washing, and keeping the baby's bassinet at least 6 feet away from your bed are some of the examples of the strategies that we use to help minimize the risk to your newborn. If you have COVID-19 that you're diagnosed with when you're postpartum, it's important to notify both your obstetrician as well as the pediatrician of your baby and follow their guidelines for minimizing exposure to your infant as well as to the rest of your family while you recover at home. You can follow their instructions for what signs and symptoms to look out for that might require an in-person evaluation. Protecting yourself from COVID-19 is important. I recommend wearing a mask when you must be around other people, frequent hand washing, and limiting your contact with those outside of your immediate family as much as possible. I know it's sad for many of our patients, but I recommend a virtual Zoom baby shower rather than the in-person event. Daily exercise is still vital to a healthy pregnancy, so finding a safe place where you can walk and exercise is very important. If you're working, it's important to discuss individual risks with your obstetrics provider so that if there's any modifications that need to be made to make sure that you're safe while you're working, we can help communicate with your employer and make sure that that happens. If you're experiencing any obstetric symptoms that require a trip to labor and delivery in the hospital, please come. It's very important that you know that the hospital is a safe place to be able to come and get that care that you need. It's much better to come in than it is to stay home. You'll experience the screening at the door the same way, the double masking the same way, and then when you're in the patient triage room on labor and delivery, all of the precautions that we take for an inpatient will still be applied in the triage obstetrics care setting. I would say the number one misconception that people have about the hospital right now is that it might actually be safer for them to deliver outside the hospital rather than coming to the hospital because of fear of getting COVID-19 by coming to the hospital. While I can understand why patients have this fear, I really want to reassure them that fortunately we have a firm handle on how we can prevent spread at the hospital, and we have had no cases of a pregnant patient getting an infection on labor and delivery of COVID-19 by coming to the hospital. Out of all of the testing that was done, we have had all of the providers, anybody who has any direct patient interaction at all, tested for COVID-19, and there was a less than 1% rate of people testing positive without symptoms. So all of the providers, all of the care team have been tested. You can feel secure in the fact that coming to the hospital is a safe place to deliver your baby. It's important to highlight that across the world, people are having increased struggles with both depression and anxiety right now. And this is especially true for our pregnant and postpartum patients. If you are having any symptoms of depression or anxiety, I urge you to reach out to your obstetrics provider for the help and support that you deserve. Finally, from all of us here at UC San Diego Health and Motherhood TV, we wish you a healthy and joyful pregnancy journey. Know that you are strong, you are brave, and you are powerful as you bring new life into this world and new hope for all of us.